Well, it's fair to say that COVID-19 has been challenging for most of us, not least of all our children who have suffered on many levels, schooling, socially and development. But what happens when your child becomes ill or starts to display the sniffles, especially now that the third wave has hit South Africa? Should you and your family go into quarantine or isolation? And is there a difference between the two? Paediatrician and allergist Dr Claudia Gray is part of African Voices of Science, an initiative by Speak Up Africa that works with leading scientists across the continent to champion research and development and ensure that the public is armed with the correct information from scientific and medical communities. Well, a very good afternoon to you, Doctor. Thanks so very much for being with us here on SABC News this afternoon.
Thanks very much.
I'm sure you saw in our intro we had some voices from young people also just kind of anxious about what the president might say this evening with regards to the restrictions. I mean, let's talk about this, the fact that this has really been quite challenging on children. Let's talk about the effects of, isolation and quarantining on our children. I heard one child saying, children don't want to sit around. That's the truth. They don't want to sit and do nothing the whole day. They want to play and do all sorts of things. I mean, what has the effect of all of this really been on our children?
Oh, I think it's affected our children on so many levels. I'm a pediatrician. I'm also a mother of four, so I see it firsthand. They've suffered scholastically at school. They've suffered socially. They've suffered with friendships, mentorships, other chronic illnesses. So they've suffered on many levels. And all of us are COVID fatigued. So are the children, so are the doctors. But I think we have to look at the reality at the moment. We are riding the crest of this third wave of COVID, and people of all ages can get COVID. It's absolutely true that the children in general don't get as sick as adults, but of course they can transmit the disease. So I do think, even though we are all fatigued, everyone has to be very aware of our current responsibilities, not only in preventing the spread and preventing ourselves from getting it, but recognizing early on if there may be symptoms that might require testing. And even though children don't tend to get as sick as adults, I think it's very important at this stage, with COVID being rife in the community, that if a child is sick, they get tested so that we know whether to quarantine and whether to isolate. And I can explain the difference between those two if you like.
Sure, please do, Dr. Gray.
Yeah, so basically, if someone has COVID-19 or they've tested positive, even if they're asymptomatic, they need to go into isolation. So they need to isolate themselves from others as much as possible for at least 10 days from the onset of their symptoms or from their positive test, so that they don't spread the disease to others as far as it's possible. So basically on day 1 of testing or symptoms, you go into isolation. On day 11, you can go back to work or school, unless you have prolonged fevers or prolonged coughs. Quarantining is if you've been in close contact with someone who has COVID-19, or within a few days of your contact has tested positive for COVID-19. So quarantining means you don't have it, but as a precaution, you are going into your own little lockdown. So in case you are already a victim of it, so that you don't spread it any further. The complication comes here if you're in your 10 days of quarantining, and during that time you become symptomatic and you test positive. That means you have to extend your period. So then you go into isolation for another 10 days. So this can become indeed an extremely drawn out and frustrating process. So I can hear those little voices. And I myself know of many families who've had 3 weeks at home because of the whole process.
And I mean, while we're sticking to the issue of children and their well-being, I mean, how can parents, I mean, obviously it's our responsibility, how can parents, protect not only, themselves, but also their children from any sort of diseases around this time? Because I think, when you have even the smallest cough, it also just adds to the crisis that we're already in. I mean, how do we kind of balance out the two? You put it quite well. At the end of the day, we must understand that we have this reality. We must understand the situation that we're in. But, how do we sort of balance out this reality that we're in? And, of course, making sure that, everybody's safe, but also that our children aren't losing their minds from having to be so isolated. And I'll use that term for now.
Yeah, this is a very difficult balance, but I think we must also put it in perspective that in a wave, we have to be much stricter, and in between our waves, we can relax a little bit with our children. But really, I mean, in Gauteng, we are riding the crest of a significant wave, and the other provinces are going to follow. Everybody is on their surfboard about to ride this wave. So we need to, first of all, just stick with the basics. Social distancing, mask wearing in public places, keeping your hands clean, keeping your surfaces clean, and ventilation. So if you are gathering, try to gather outside. Yeah. This is really the time to stick with your small bubbles. As tired as you are of your bubble people, this is a very important time. Yeah. If you get out of your bubble, you will get into trouble. The other thing to mention is that these large indoor gatherings with poor ventilation and inadequate mask wearing, such as our nightclub situation, such as our teenagers like to do, are very much hotspots for COVID-19 spread. And on this arm and leg, I'd also like to say, we really are not going to get very far without mass vaccination at this stage. So please, to our adults, embrace vaccination. Don't listen to all the hype and the inaccuracies on social media. It's much safer to get vaccinated and to get COVID-19.
Yeah, and just as we close up the conversation, I'm just thinking about it, when the children do become ill and you do suspect that, it might be COVID related, it's very difficult to be an isolated parent. You've got, when your kids are sick, the first thing you're doing is kind of being at their bedsides and close to them. But at this time, you could actually be catching something that could be worse off for you while taking care of your child, who might not actually be as affected as you would be by the virus. So I wonder, how do we handle, a situation like that? I mean, do you kind of ground your children for nothing? What do you do? Just some advice, really.
I think you're really talking about a very difficult question. I mean, I myself know it's incredibly difficult to isolate yourself as a family from your young children. So often this is not realistic. But I think certainly protect the vulnerable. So if one parent has a comorbidity, then at least let that parent move out for a while the healthier parent looks after the kids. And secondly, if there's extended family in the house, such as grandparents, then just make very sure that they are isolated from or in quarantine and away from those at risk of COVID-19 or who indeed have COVID-19. And, often in our less well-off communities, there are 10, 11 people in the house. So it's extremely difficult. So we just have to be very, very disciplined that family unit isolates or quarantines as it may be. So I can't stress more these points of we're heading for trouble, so stay in your bubble. Yeah. And of course, our liberation ultimately will be through vaccination.
All right. Dr. Claudia Gray, pleasure speaking to you. Thank you so very much for availing yourself to SABC News this afternoon.
It's a pleasure, and thanks very much.